Hello and welcome to another episode of the Best You interview series. It's Gary here again. Thank you very, very much for taking the time to tune in to this episode. And today I'm delighted to be joined by entrepreneur and founder of the Menopause modules, Dr. Kate Hawkins, who is here to discuss her work in the menopause space. Before we go any further, I have permission from Dr. Kate to call her Kate from this point going forward. So I will do just that. Kate is a Menopause Society certified practitioner and a certified Girls Gone Strong menopause coaching specialist, also holding certificates from the Culinary Health Education Fundamentals, Chef Programme and the Institute of Lifestyles Medicine, Spalding Rehabilitation Hospital, Harvard Medical School, and from Jen Pike's The Hormone Project Academy. Kate is also a certified chiropractor, a contemporary medical acupuncture provider from McMaster University, and holds a Bachelor of Science in Kinesiology from the University of Alberta. Kate co-founded and co-owns Encompass Sports Therapy and Encompass Holistic Health Clinics in Calgary, Alberta, and that's how we met. I'll talk about that a bit more in a wee bit here. Kate's interest in menopause grew directly from her work in chiropractic, where over time many of her patients began voicing questions and concerns about changing in their bodies as they moved through midlife. They shared their diverse experiences, and these conversations highlighted the need for a comprehensive menopause-focused support and resources that validate these experiences and educate and empower women through this very, very important and poignant phase of life. And that's why Kate sought specialised education and training in menopause care to help women navigate these challenges with knowledge and confidence. And it's such a brilliant story about really, truly listening to what the patients are saying and then acting and reacting to that information. I absolutely love that part of your journey, Kate. And as I said earlier, that's how I got to know Kate and her husband, Mike. Encompass is my chiropractor and physio of choice, having been introduced to them through my lovely ex-wife, Dawn, a number of years ago now. That must be about 10 years ago. I can't even remember how long I've been a patient there, but lots of things go wrong with my body at times, and I do need that specialist help. I've been through a number of physios and chiropractors there over the years, and just very recently finished some physio with Sydney, who did a wonderful job on my calf to get me back up and running, literally and figuratively, as we move forward. A great clinic, and it's great to see, as we were chatting pre-interview, it's great to see the growth of the clinic as well. Just such a great Calgary story and such a great client service story. Kate, thank you very much for joining me today.
Thanks for that nice intro, and thank you so much for having me. I'm happy to be here with you.
Absolutely, my pleasure. And it's been a wee while in the making for us to be able to make this happen, and I'm so delighted to get the opportunity to chat to you about it. So I mentioned quite a few things, especially your qualification journey as we were navigating through the intro there. Tell me a bit more, add a wee bit more meat to the bones, as it were, in terms of your background and your journey thus far that got you to the point where you thought, you know what, menopause needs a bit more care and attention than it's getting today.
Yeah, thank you. You gave a very detailed intro, so you hit all the highlights of my education. In terms of how I got to menopause specifically, is not something that I thought that I would be doing. I didn't have really any awareness, any interest, because I didn't have any exposure as a young person and as a student. But as you touched on in the intro, I'm a chiropractor. I work clinically with all kinds of people, men and women, and really young ones and really not so young ones, and lots of ones in between. And I really started to find over time that I was hearing questions from women in particular saying, I've got this kind of new weird symptom. And it wasn't necessarily musculoskeletal in nature. Sometimes it was, but sometimes it was reports of fatigue or reports of mood really feeling like it's all over the place, or, skin conditions, things that, people would kind of go, geez, this is new and weird and different, and I wonder what it's all about. So we sort of track like, I'm hearing, these concerns from some of my patients. And over time, it became clear that there was a certain demographic that was voicing these concerns more often than others. And it was women kind of in that menopause cohort. And when we say menopause cohort, what I mean by that is anybody who's sort of in that perimenopause stage. So that could be about 35-ish, mid 30s, until sort of 55-ish and beyond. And so there were these questions coming to me eventually. Do you think my hormones could be implicated here? Is there any reason why this would be happening now when I haven't seen it before? And at first, my answer was maybe. And over time, that didn't feel like a very sufficient answer. What we need is to feel heard, to feel that our concerns are being taken seriously, and that if we don't know the answer, that we look it up, that we do some research, that we collaborate with other professionals, and that we can go back to our patient with that information. And so eventually, it started to feel like, oh, I better go into the research. I better see if I can collaborate. I better get a better answer than maybe. And so yeah, that's really how it came to be, was that, through my musculoskeletal care of, patients, it was really this feeling of, we need a little bit more for this particular cohort, and I don't have the answers. And so when I went into the research, I went, okay, this is a rabbit hole. Kind of one thing would lead to another, but it didn't feel like there was a very kind of robust field that I could look into and follow it sort of specifically. It was really this, as I said, rabbit hole. And in that case, I then kind of went, okay, like where can I learn? And so what I actually did was I did a lot of Googling, as many of us do. What courses are available, who certifies practitioners in menopause care. And so what I came to was the Menopause Society, which is formerly the North American Menopause Society. So many women know NAMS is the acronym, but NAMS is now just the Menopause Society. And the Menopause Society is the body that essentially sets a standard of care for menopause care in North America. And so many healthcare providers, whether it's more medical, so doctors, nurses, pharmacists, and also more sort of allied care, so people like myself as chiropractors, physios, other healthcare professionals can take that credential. And so basically, it was a lot of self-study. There's a textbook, there's a lot of position papers, there's the encouragement from the society that you soak up every bit of knowledge that you can. And so, interestingly, a few years ago when I started to obtain this education, there wasn't actually a lot of contemporary medical books. There's many, 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 many now, which are, excellent. I feel like I've tried to read all of them. When I was studying, there were two really that were kind of in the circulation. And in terms of what I read, I'm sure there were more than that, but there were two that were easy to kind of go and find and look through. And there were no podcasts. People weren't talking about it. And so now, a few years later, it's very much in our environment. Listening and hearing and learning. And so we're really finding that there's more of this interest and a move in terms of more research and more education about menopause. So that's a long answer of how I came to menopause.
No, it's great to get the background and a couple of things. I mean, like my experience. I mean, the conversation has been normalised now, whereas before it wasn't. I mean, I remember when I was growing up, and my mum had, I'll probably get the number wrong, but 4 or 5 sisters, something like that. And all kind of roughly about the same age. And then we would just see them essentially fanning themselves because they're getting very, very warm. And we'd be kind of like, what's that all about? We live in Scotland. It's not that warm there, And it would just be the literal reaction, or the literal reply to that would be the change of life.
That's
and
right.
then, which basically meant, shut it, don't ask any more questions, and then we'll just move on. And it becomes a thing, like, you just, as you said earlier, not a lot of exposure to it, not a lot of impact from or by it until you start to get the patients. And as I mentioned very briefly in the intro there, the key thing is, Kate, that you could and possibly should have just said, it's not my area of expertise. It's something that I will have to contend with myself at some point, and maybe we could have a conversation then. But what I can do is I can refer you to this other place. And what sets yourself apart is saying, that's actually not good enough. And that's not the type and style of care that I want to give to my patients. So let me go and actually do something about that. Not every doctor's doing that.
Oh, thank you. Well, it's a really good kind of question that you're asking there, Gary, because to be honest, I'm queen of referral. I love to say I'm not the best person for this. Please let me send you to someone else who has more education, more experience, more expertise. In our Encompass clinics, we work on a collaborative leadership model where we know that we can't be all things to all people, and that there are some people who have, as I said, that education or experience with a certain condition where they're going to be more the expert, or certainly somebody outside of our clinic who's going to sort of help the patient navigate things in the most efficient or effective way. So, had there been somebody who I knew of
Yeah.
who was educated in menopause care, I would love to have referred to that person. And even now, where I'm a few years into the education and sort of the practice of trying to spread that education to my patients and beyond, I still need those people in the community that I can refer to, because of course, being a chiropractor, although I'm also a Menopause Society certified practitioner, my scope is such that I can provide the education, I can provide guidance based on the clinical guidelines and the best understanding of the most current research, but I can't do some of the things that will be necessary in terms of creating the best plan of care for a patient. So I can't do certain diagnostics, I can't prescribe medications. So that's where we really need to use our partners in the community. And I'm trying always to kind of find who has this education, who has this interest, who can I work with. But at the time that I was starting to receive these questions, and I thought, okay, I need to go get this education, there just was not a lot of talk, as I said, in contemporary medical literature, on podcasts, like in terms of things that are easily accessible and consumable to our patients, but also not really with a lot of our healthcare practitioners. And the reason for that is that there has not been a lot of menopause education in our system. Now, for somebody like myself, where I'm allied health, that might make sense. You might think, but you're a chiropractor, like, why would you need to be concerned about menopause? But this is true also for our medical doctors, our nurses, our pharmacists, and I'm making a generalization and I'm speaking for those groups, but many people in those groups have said, geez, we have not had enough education. And so, in terms of me deciding, okay, I need to get this information so I can answer questions, it was because there wasn't someone that I could immediately identify at that time who could answer those questions. We are improving. More and more and more practitioners are realizing the importance of this, and it will get better over time. This will be a conversation that's not necessary, this one between you and I, in terms of, having the exposure. Like, listen, some people in the community know, and we can, connect patients to resources, because I think in the future it will just be done automatically. It won't be something that feels novel or new.
Yeah. Do you think, in your experience and or opinion, there's a specific reason or reasons that there is that lack of, if I could say focus, that's my word, not your word, like focus and dedication? Is it because it simply doesn't drain the health service as much as other ailments or situations or circumstances do, so they don't really have to throw a lot of time, effort, or energy towards it? Or is there something else that's kind of behind that?
It's a really good question. It's not a very encouraging answer. I think many people in this kind of space who have taken on a lot of menopause education would tell you that there's a lot of historical and political context. So, what we know is that there's not a lot of medical research dollars that go to women's health. This is improving, this is changing. In the last probably 10 years and the last 5 years, there has been a big push to include women in medical research. But in many cases, medical research is done particularly on men, because women have a monthly cycle, right? And that menstrual cycle is a little bit complicated in terms of standardizing. Now, medical research is not my domain, so I'm really paraphrasing based on my understanding of it. But essentially, a lot of the medical research on conditions, on medications, is done on men and is extrapolated to women. So that piece is is difficult in that, women are not actually just smaller men. Which
Mm.
sounds like a funny soundbite, but it's something that's been discussed quite a bit in the sort of, again, more recent sort of medical literature and contemporary medical discourse. So that's kind of one part. Now, the second part is that when medical research is done on women, it tends to be done in reproductive aged women. So when we're post reproductive age, when we're into that menopause and perimenopause, postmenopause phase, um, we don't see very much research at all. And so, in terms of then, if we don't have a lot of research, we don't have a lot of textbooks saying here's what we know about this population, these conditions, and these medications. And if we don't have the textbooks and the research papers, it doesn't really make it into curriculums in the same way that other topics do. And so there's this sort of trickle down effect of we don't learn about menopause.
Yeah.
So again, this is changing. I don't want to sound really bleak. This is improving, but it's where we're at right now.
Yeah, that's absolutely fascinating in terms of, a lot of the unknowns as a regular member of the public, not connected at all with anything to do with medical, the medical industry or the health industry, I should say, and what the practices and processes are in the background. Just as a complete layperson, you know, if you're doing if you're doing research on something that's happening to another gender on another gender, that seems a little bit backwards to me, and I don't know the historical context, and we probably don't need to get into that today. But just another reason to get confused with the way that the world is
Yeah.
these days, I think, is probably the best way to say it.
And
It's,
again,
it's
it says why we should see change, why it's necessary, and why that's hopeful. But medical research takes a long time to get to essentially go from sort of the interventional kind of stage to making it to clinical guidelines, for example. So even some of the guidelines that we have now for menopause care, I'll tell patients, here's what the Menopause Society says, here's what the guidelines say, but there's this always kind of proviso that I say, listen, in the next 5 years, 10 years, 20 years, this may change depending on, what this new emerging research says, because again, it is changing. There's more funding that's coming for women's health. I think because there's been such an increase in interest in menopause, we're seeing that change. And, when you asked before, does menopause not drain the system as much as other concerns? What we need to know is that menopause is not just hot flashes, right? I know you use that as an example with your mom, but the thing is that there's no particular set of symptoms that every single woman will have. So some women may have really, significant hot flash symptoms, and that might be sort of the bulk of what she might have. There might be a woman who actually has not a lot of symptoms that she can see or feel, but she might really notice as she's going for her annual physicals, wow, my blood pressure is going way up, my cholesterol is going way up, my coagulant factors in my body are going up. And so we're concerned about then cardiovascular risk factors, for example, which is a huge drain on the system. Cardiovascular disease is the leading cause of death in women. And so when we're talking about menopause, we're not just talking about the cessation of ovarian function, which is going to lead to having no more periods. We're not just talking about heat in the body. We're not talking just about fatigue and about, muscle pains. We're talking about cardiovascular health. We're talking about bone health. At the time of menopause and beyond, we lose up to about 30% of our peak bone density by the time we're 80. So that starts with about a pretty precipitous drop of about 12% loss of peak bone density in the first 5 years post-menopause. And if we have that and we have the subsequent diagnosis of osteoporosis, 50% of osteoporosis patients will have an osteoporotic fracture, which can lead to chronic pain. It can lead to changes in function and autonomy. In some cases, it can even lead to earlier mortality. So, in terms of a drain on the system, we have to think, what are the long-term downstream health impacts, and not just what are the symptoms that we can see and feel. And we need to kind of treat the whole picture. Now, when I say treat the whole picture, Treatment does not necessarily mean every woman is going to have hormone therapy. There are some women for whom it makes sense, and they have the appropriate indications to use it and lack of contraindications. There are women who will be the exact opposite. There are going to be people that say, listen, I don't want that intervention. What are the alternatives? So why the menopause modules is important to me is so that we can have these conversations about, listen, here's what might happen for symptoms. Here's what will happen in terms of those downstream health impacts as a result of hormonal change. And here are options for treatment, for therapy. And we have to have this conversation in what they call the window of opportunity. If we miss that window of opportunity, which is set by research and clinical guidelines, to say when we have the safe and appropriate introduction of some of these therapies, if we miss that window, we have closed that window, which means we have limited the therapeutic options. And this is, again, if we say just hot flashes or just pain, this is a long period of life. Perimenopause lasts anywhere between 4 and 12 years. So that's a long time to just be hot. That's very significant to be uncomfortable, to potentially not be sleeping well, to be feeling like it affects your mood, which are all potential sequelae of the hot flashes. But after we get out of perimenopause, we're menopausal and then we're postmenopausal. So what that means is that if we experience menopause at the average age for North America, which is about 51, and we live to the average life expectancy, which for women in North America is about 83, that means we spend about 40% of our lives in menopause. So we need to have these conversations so that we can say, hey, if you're hot, if you're sore, if you're uncomfortable, if you can't sleep, if your moods are feeling terrible, or if you have none of those, but you have for sure that decrease in bone density and increase in cardiovascular risk factor, here's how we can help you be well and live well.
Yeah. And be more educated and prepared at the same time. I'm so glad you talked about some of the symptoms there, Kate, because I was going to ask about that. I mean, it's very obvious it's not a one size fits all. And in my very limited experience with anything medical that's ever happened to me, or any conversation I've ever even had about medical issues or so, it just manifests itself differently in different human beings. So it's very, very difficult to say this is exactly what it is and what it looks like. And you mentioned, I was actually quite surprised when you said earlier, around about 35, to, if it's 12 years, 47-ish or thereabouts, if it was at the longer end. What recommendations would you have to women in and around that age in terms of their diligence, paying attention to the information that they're receiving, physically, emotionally, and the data that comes through various blood tests or whatever types and styles of tests that they're going through? Like, is there and maybe we're now getting into the menopause modules here. Is there like a foundational way of saying you need to pay more attention to this, or you need to start paying a different type of style of attention and then taking action on the data that you're receiving?
That's a good question. And I think maybe what I'm understanding, and you can correct me if I'm wrong, but the question is about diagnostics. How do you know when you're in the stage where you should be paying attention? Is that right?
Yeah, and even possibly potentially before that, saying there's going to be a period of your time or of your life that's coming up that we don't really know how long it's going to last, and we don't really know what's going to manifest itself in terms of your experience of this.
Mm-hmm. Yeah.
But what you really should be doing is paying attention to what information and experience you're having.
Yeah, and that's where I think there's a lot of room for optimism here, is that I think even in the last 3 years since I started my own sort of journey of obtaining the education and having conversation with anyone who will talk to me about menopause, it's my favorite topic, is that I think we have a lot more just awareness, and awareness is half the battle. So where, as myself as a woman and a healthcare provider, I really, it was not on my radar until it was. Yourself,
Yeah.
as you're saying, it's not something that's going to directly affect you. but you also haven't had like a lot of exposure. I think having these conversations, listening to the podcasts, looking at the book that happens to be on that bestseller table as you walk by in a bookstore, I think it's a little bit in our environment now where even if you're not tracking, oh, I want to pay attention to that or talk to this person, I actually think it's coming at us. So that's helpful in that I think there's kind of just awareness in the environment. In terms of how should women pay more attention or different attention, I think what's going to happen is they're going to have, I hope, a little bit of background awareness. And then if they start to go, I'm having this symptom, I'm noticing this, that they're just kind of listening to the body. It's not something that I would say you have to do in a specific way. Some people are going to keep symptom charts. Some people are just going to kind of note and do a little bit of watchful waiting. Some are going to chat with their friends about what they're experiencing and kind of compare notes. And so that awareness is super important. And then when it feels like, okay, I'm ready to kind of dive into it, there's a lot available for us now. In terms of diagnostics, that's a question I get a lot is, can we just run a quick blood test? And the answer is no, not in the way that you're asking. I think a lot of people are asking, can we run my hormones and will that be helpful? The research says no, in most cases. There are certain clinical conditions that we would say, yes, we do need to run certain hormone panels to rule in or rule out other conditions. But generally, the answer for most women is no. And the reason for that is that there's not just this precipitous decline in a linear fashion of estrogen, for example. So what happens is actually it's a little bit wonky. It's up and down, and one day could truly be here, and one day could be here. And so depending on when we're doing that blood test, it's not actually super clinically relevant. There are other hormones that we can run that would sort of retrospectively, after we're already suspicious that menopause is complete, that we could say, if we're trying to confirm the diagnosis, we could check on. But mostly how menopause or perimenopause is diagnosed is by chatting with the patient, listening to what's going on, correlating that with age. Are we within, an age range that is possible? And then ruling out other conditions. And so this is where, when people say, can we do a blood test? I would go, running a thyroid panel, great idea. Running a CBC where we're looking for iron, for example. Do we have low iron? Could that be mimicking some of your symptoms? So there are certain things that absolutely should be run in terms of diagnostics, like, blood tests. But the hormone part is not supported in the research for most cases.
Right.
Yeah.
Right. Even just by virtue of literally this conversation, I'm becoming more educated to be able to have conversations with prospective coaching clients of mine, or coaching clients with mine, or friends, or family and such. So the menopause modules, there are two particular tracks within the menopause modules. Tell me about them.
So again, both of them are education based, although I so wish I could close that clinical loop and be able to order those diagnostics and be able to prescribe, just for ease of the access for patients. Again, in terms of my scope, what I am allowed to do is to educate. So the kind of one track is individualized consultations. So sitting kind of like you and I are sitting, and having a really in-depth conversation. And so I use the Menopause Society validated questionnaire for intake. So it's essentially a big 15-page questionnaire that asks every question you could possibly think about, all the different kind of physiological systems, experiences, expectations in terms of menopause. And then we kind of funnel down from there. So we work through, what are the main symptoms that you're feeling? What are the main concerns in terms of personal health history, family health history? We're going to be looking at, are there particular contraindications? So things that say you may not even consider giving hormones to this patient, which again, I want to disclaim, I wouldn't be giving. I would be suggesting that it's possible to have the conversation with the primary care practitioner. But it would really be essentially doing some planning to say, okay, based on what you're telling me, based on what the research says, a good place to start to collaborate with your primary care provider is this, with a list of diagnostics, with a list of potential treatment options. And then, of course, the part that I am really good at and able to kind of do in terms of acute like recommendations would be the lifestyle medicine part. So really looking at what does the research say about how can diet support you, which supplements, what exercise programming, and kind of being a bit specific on those things. And so that's the individualized side. So it's very much based on what can you do according to your experience. And then the other side is a comprehensive course. So it's really just, the little tidbits that I've kind of said to you about osteoporosis, for example, or cardiovascular disease, really kind of diving in and saying in depth, like, why does this happen? What do we see? How can we mitigate it? And so it's really about sort of just going through the more general information, so not individualized to a particular patient, but to say, okay, here's what the hormones are doing. Here's the symptoms that are possible. Here's the downstream health impacts that are absolutely going to happen as a result of hormone change. And then here are the hormone, non-hormone, and lifestyle medicine interventions that can be implemented depending on the person.
Yeah. Do you have a recommended age group that would be more on the education side to say, this is for you if you are 30 to 35, for example, or is it's never too late?
Yeah, great question. Education is for everybody. In terms of who is going to feel like I'm speaking right to them, it's going to be women in that perimenopause, menopause, postmenopause cohort. So, mid, late 30s is a great time to start to probably pay attention for most women. Again, we can shift these ages earlier or later depending on the individual. But for most women, around kind of mid, late 30s is a great time to start to pay attention to it. In terms of, is it ever too late? No, but the window of opportunity to be able to access all of the therapies tends to close the closer we get to 60 years of age, or if it's 10 years post menopause. And by that, I should make clear, because not everybody knows, that when I say menopause is the diagnosis that's made exactly 12 months after the last menstrual period. So menopause is actually one day. So the time before that, where the menstrual cycle gets wonky and we might see some, symptomatic kind of presentation, and we'll start to see those changes in terms of the downstream health impacts. That'll happen in the years before that. And then post-menopause is the time after that. But menopause is literally one day, which is 12 months after the last period. So when I say 10 years post-menopause, that's what we're going for, is once you're 10 years after that point, again, that window closes.
Yeah.
I think this will change. I will disclaim that it's not my research that's happening. I'm not a medical researcher, but I do think that we will see that the window will widen a little bit over time. But how long it takes to get into the clinical guidelines is yet to be seen.
So what would you say to someone who is, as it stands today in terms of the research being 10 years, what if someone's beyond that, but they're still saying, this can't be all it is. There has to be some sort of relief support,
So
right side.
Yeah, absolutely. So that's a really important distinction to make, is not that there's not support or relief, but that some of the therapeutic options, particularly hormone therapy, will be off the table, and or it's going to be a lot more nuanced discussion with particular providers. So I would say there's help, there's support, understanding, and education can make a big difference, even just to kind of that feeling of, should I be worried? Is this safe? Is it just me? I think sometimes the education part can just even be helpful in terms of normalizing, validating, right? But in terms of empowering someone to actually like change their experience with some therapeutic options, they still exist. It's just that there are fewer things that are available at that point. So never too late, but you want to make sure that you're with someone who has the education. Unfortunately, again, because it's not with many of our practitioners that are practicing now, it was not part of our education, any of us, whether it's allied health professionals or medical side. It was teeny, teeny, tiny if it was covered at all. So there may be the experience that some women will go to their practitioner and ask for support, and the practitioner might not have a lot of tools in the toolbox. And that's where I would encourage women to, if you can, seek out a second opinion, seek someone with the Menopause Society certified practitioner credential. And, whether you can access that person or not, I think, again, there's this optimism of there's a lot of information you can access on your own without even having to visit a healthcare professional. Now, accessing that on your own, again, is only going to give you that education piece. It's not going to close that loop clinically. But certainly there's a lot of really good contemporary medical literature available right now that can support women through the different stages of the menopause transition.
Yeah, absolutely. And then the ability to be able to be educated, to know and understand what that means for you,
Yeah.
and then ask the right questions, hopefully, if you have access, as you say, to the right professionals. So in terms of, it's kind of scary that you say that mostly all medical and allied health, support practitioners and such have minimal exposure to through their education
Mm-hmm.
to menopause as a topic and as a thing that would come to the fore and be prevalent for the treatment and care that they're trying to provide. I imagine that would be compounded if it's a male, and if you go to a male doctor and the male doctor's like, I, I don't know what to say. I don't know what to do. I have no idea, but I would just imagine that's the case. Has that been something that you or your clients have experienced?
Maybe. I wouldn't want to generalize in that way because, of course, there are many things that males don't experience but can be really, really efficient and effective and sensitive in treating and addressing. There are lots of course, male gynecologists and obstetricians, and so I think just because someone who's male doesn't experience the same things as a female doesn't mean that they can't do a great job addressing it. I think when you see a female practitioner, she may or may not have had the same experience as you
Yeah.
in terms of the menopause experience, right? There again, for some women, it's going to be they have hot flashes and they are just feeling totally dysfunctional because they are so hot and sweaty and their heart is beating fast and they're getting that anxious feeling, and then they've got sweating and chills. And then somebody beside them could go, I don't have that. What I have is this feeling if I'm awake at 2 a.m. and I can't go back to sleep and I'm just so tired I don't know what to do. And you can have somebody beside them going, I don't have any of that. So I think sometimes there's a feeling of if you're working with someone of the same sex, they understand your clinical experience. And that could be true in some cases, but I think we shouldn't count out great male practitioners. Interest makes a big difference. And However, any practitioner comes to their interest in menopause, having that extra interest and extra education and eventually expertise, I hope, is what matters. It doesn't matter probably whether it's male or female.
Yeah, I love that. I kind of an analogous situation for me through my coaching practice is the exact same as you described there, Kate. If someone comes and says, I'm having an issue in the workplace or my family or my community in this way, and I really want a female to help me with this because I think, female to female is going to be a better experience, my reaction would be, well, hold on a second, tell me a bit more about it, and then I'll tell you whether I'm actually the right person to
Yeah.
help you with this.
Mhm.
It's a human experience is a human experience is a human experience
Yeah.
to that as well. So in terms of immediate next steps for someone listening to or watching this podcast that says, I'm just about ready to get myself a bit more educated, this has certainly piqued my interest, what would you recommend?
Um, I have a couple of favorite menopause books that I'm always happy to recommend. So just in terms of again having that access of I can order it on Amazon at 10 p.m. and have it the next morning, or I
Yeah.
can read a book while I sip on my coffee and just take a few minutes to myself. If they're kind of at that stage of wanting to just get a little bit of that, I love Jen Gunter's book. which is called the Menopause Manifesto. It is excellent. Jen Gunter lives and practices in the States now, but she's a Canadian gynecologist. So that was the first menopause book I read. And, going back to when we were talking about just very, very briefly that political and historical context of, how did education and discussion about menopause, how did it look kind of way back when, and what does it look like now, and what are we hoping for later? I think Jen Gunter does a beautiful job of discussing that, and then going into symptoms and health impacts and treatment options. Really, really strong book clinically. It reflects very closely to my textbook from my Menopause Society certified practitioner credential. So I love that one. That's probably my favorite one. Dr. Mary Claire Haber is a major menopause influencer, if I can say. Now, having said that, she's also a double board certified physician. She is really, really an excellent resource. So she has a book called The New Menopause, which is excellent. I hear there's a new book coming out just specifically about perimenopause. It's not out yet, but I think maybe January. Don't quote me on that, but it's possible that we're going to see something new come soon. When I said, there were 2 books when I was studying, those were the books. And as time went on, there was a couple of really excellent ones, including The Menopause Brain, for those women who might feel that they are having a lot of mood changes, or they're having sleep issues, or they're feeling cognition changes, feeling this like brain fog, forgetfulness. That's Dr. Lisa Mosconi. She's an excellent resource that way. So I love those as kind of a way to, have some in-depth but also really accessible information. As I said, podcasts, they're all over the place. It feels, again, like, we have had nothing, and then all of a sudden this huge explosion of a ton of easily accessible information. So each of those women that I mentioned, if you Googled, have they spoken to somebody on a podcast, they absolutely have. Particularly Dr. Mary Claire Haber. She has made a lot of rounds with a lot of podcasts. So, that's a great way to start. If somebody wanted to have a little bit more of this kind of somebody leading them through it, come and see me. I am happy to see people one-on-one, as we talked about, but also I'm really trying to make the education component as accessible as possible. And so again, this is a relatively new part of my practice in the last couple of years. And so we're just trying different iterations over time. So coming up, I have a bit of a workshop that is with in partnership with Studio 85, which is a yoga studio just up here local to us. So we're sorry?
I know it well.
Yes. They're wonderful there. So we're doing a little workshop with a bit of a yin and breathwork practice, and a very kind of small intensive. So I'm going to speak for maybe 60 to 90 minutes and try to give as much detail as I can in that time. And then I have a couple of more in-depth 3-hour workshops that are coming up in November and January, respectively. One in person at one of our Encompass clinics, and one online. So, in that case, if it's the feeling of, okay, I've done some of the, research and reading by myself, but I'd like a little bit more of a guide through it, either in a group setting or individually, that's what I can offer. But there's certainly a lot of different avenues to access information now.
Fabulous. That's great news. So as you know, Kate, this is called The Best You. And what I do is I take this opportunity to ask each guest, what's a regular practice that Kate employs to give Kate the best opportunity to be the best version of herself?
Yeah, it's a very good question. We should ask everybody this question, ourselves and our cohort. So exercise is the thing. And when I say exercise, it can be planned exercise, like going for a run or picking up some weights, which I'm trying to do more often, that strength training part. But also just like getting outside, like being outside, if you can walk or run a pathway when the trees are changing color. I love to be at the reservoir and see the water at the same time. That's my thing. Exercise is, not maybe a cure-all, but a help-all, I think, in terms of our mental and physical health and wellness. And yeah, that's my thing to make me my best, for sure.
Love it. I love it. Kate, where can people find out more about you and the menopause modules?
So you can go to my website, which is menopausemodules.com. There's also some information on my menopause services on our Encompass website, which is encompasscalgary.com. And yeah, I'm really happy to answer questions or consult as needed. So I'd love to hear from anybody who's interested.
Tremendous. Kate, I've been looking forward to this for quite some time, and it's been absolutely brilliant and massively educational for me. I hope it's the same for the listeners and the viewers. Thank you very, very much for coming on the show
Thank you
today.
so much for having me. I really appreciate it.